My name is Dr. Valda Crowder, also known as Dr. V. Been an emergency medicine physician now for 30 years. The source material for this information is on my website, which is AskDrV.us. You can also follow me on Twitter. And what we basically do is this is a slide presentation followed by Q&A. And there's some basic slides that never change. And then we update other slides with information that has occurred since we last talked. So the structure is a 10 to 15 minute slide presentation followed by Q&A that will be 30 to 45 minutes. And we usually end right around 9 o'clock, sometimes a little bit before. During the presentation, everyone is in listen mode so that everyone can hear everything clearly and there's no background. You can always type in while you're listening to the presentation, either in the chat or the Q&A. You can type in your questions as you go. I take written questions first, and then if we have time, we can actually come off of mute and ask questions live. The intention is to keep webinar participants informed about COVID-19 science that will help them and their families stay healthy during the pandemic. We are getting ready to enter the worst phase of this, so this is really, really important. The next 3 to 4 months will be absolutely critical. The outcome is that you'll leave the webinar motivated to create or adjust an action plan for yourself or your family, or you may be creating or adjusting an action plan for a broader community like a church or a school or a homeowners association or a union or something along that line. Now, this was in the news on Sunday. White House Chief of Staff stating on television that we are not going to control the pandemic. I really don't know quite what to say to this, because what this leads me to believe is that their only strategy is basically wait until there's a vaccine, when there's so much more that can actually be done. We have moratoriums around the country around heat and electricity and utilities. Some states, the states that are in purple, have a moratorium in place. The states that are in red have no moratorium in place. And those are the states where people will begin to see their utilities shut off. We also had recently Southwest Airlines announce that it will start selling the middle seat. So Southwest Airlines was not selling the middle seat starting November 30th. So this is something, if you do plan on flying, I don't recommend flying, but if you do want to fly, you do want to know what the policy is of the airline. DC City Council actually is considering a legislation to allow children as young as 11 to get the vaccine without their parents' consent if they want it. This is going to be very interesting what we're going to see here around parents and children. All right, so respect COVID-19 is highly contagious. How is that calculated? Well, how much time do you have to be exposed to it in order to be infected? And as we've often said on this webinar, that it can be as little as 45 seconds. Now, percent penetration is how many people actually get COVID-19. If 100 people are exposed to it, COVID-19, 60 to 80% of them actually get COVID-19. That's compared to the flu, which is 30 to 40%. Now, just on Friday, the CDC actually put out a study that said what we've been saying in our webinar now since about March. And the CDC study said that you can actually catch COVID-19 in under 1 minute. Dr. Fauci also said that a lot of people don't realize that they can actually get COVID-19 just with regular talking. People are thinking sneezing and coughing, but regular talking can also actually expose you to COVID-19. It is both a droplet and an airborne disease. Droplets are bigger particles that are 5 microns or bigger and land within 3 feet. Airborne particles are smaller and actually can travel much further. So think about tuberculosis or measles. So this just gives a schematic of actually what that looks like. The red particles are droplets and the gray particles are smaller, and those are airborne. So there's all the things that are in the pathway of this, right? Is there a park bench? Are there other people? All of the things that could potentially, are there handles or um, uh, doors where you're opening and closing and touching, etc. Now, how do you know if yourself or your family has COVID-19? There's 3 tests. There's a PCR test, an antigen test, and a CAT scan test. I actually just recently had the PCR test myself, not because I was sick, but because I was going to get an outpatient procedure and they wanted to make sure that people were COVID negative before they actually had the procedure. And that is the one, the PCR test is the most accurate test. And that is the one where they stick it very, very far up your nose, hold it up there. I mean, it almost brought tears to my eyes. So it's very, very uncomfortable, but it actually is the more accurate test. The antigen test, which is also known as the rapid test, that is a test that detects proteins on the surface. And that is negative 20 to 30% of the time when the person really has COVID-19. So when we use the rapid test in medicine, we make sure that the person has 2 rapid tests separated by 24 hours that are both negative. Now, some people have repeated tests that are negative, and we do a CAT scan, and we actually see the signs of the inflammation or even the scarring or fibrosis on the actual CAT scan. And it's kind of like a ground glass white appearance in the lungs, which you can see on the bottom film there in the middle with the yellow arrows. We talk about the 6 clusters of COVID-19. It can present a lot of different ways. It is not just a respiratory disease. It can present flu-like without a fever, flu-like with a fever. You can also, with COVID-19, have just nausea, vomiting, and diarrhea. You could think that maybe you ate something wrong. And then you can also have fatigue, confusion, and then sort of all the symptoms together. So when people have the fatigue and the confusion and a lot of respiratory complaints, those are the folks that actually usually have to be hospitalized. What is important is there's really a 7th cluster, which is those people that are just completely asymptomatic and do not even have a fever. Those people can transmit COVID. Treatment plan is pulse oximetry to make sure that your oxygenation is 95% or above, vitamin D, zinc, famotidine, Decadron, which is a steroid, remdesivir, and also you hear some stuff about Regeneron. Regeneron is the company, it's not the medication, but they've got an an antibody cocktail that is in an experimental protocol. So famotidine is Pepcid, AC, and this blocks histamine release. So a lot of what happens with COVID-19 is all of the inflammation associated with it. This has actually been shown to lower hospital deaths and to lower combined outcome of death and intubation. Steroids also decrease inflammation, so they lower the 28-day death rate. Remdesivir actually blocks the replication of the virus. It's been shown to, it may get someone off a ventilator a day or 2 earlier. It does a little, I can't say it necessarily does a lot, but the studies are just clinically from what we're seeing, but the studies have yet to be published. Regeneron, which is an antibody cocktail, this is in a experimental protocol. So you either get this or you get the placebo. And this is 2 antibodies. One antibody comes from a human that has recovered from COVID-19. The second antibody is from a mouse that is engineered to have a human-like immune system. And these antibodies then bind to the main spike protein that blocks the virus from attaching to human cells. So that's basically how all of the basic treatments work. So if you found out you are COVID-19 positive, it's preferable to actually quarantine for 21 days as opposed to 14. About 6% of the people are still shedding virus after 14 days. You want to have in a quarantine room pulse ox, and I think I have a picture of one here. Yep, there you go. Zinc and vitamin D3. I recommend that people take these supplements whether or not you're positive or not during this pandemic, because these supplements are very, very important in making sure that you have a milder disease. You want to have access to a bathroom that only you use, your cell phone to call 911 if you need to, have people leave food at your door, open your windows, and if you live with other people, you want to have a HEPA filter. Now, when we look at the cost of the care, it varies dramatically by age. People between 51 and 60 cost the most, but the average cost of a hospital care is between $35,000 and $45,000 per each COVID patient. Some people actually need an air ambulance ride because they are live in an area that is a medical desert and they're not near a facility that has specialized care. That air ambulance ride itself can be roughly about $50,000. Now, you've heard people talk about herd immunity. Now, there's two pathways through herd immunity, but let's first talk about what it is. Herd immunity is when people aren't getting the infection anymore because a significant amount of the population has become immune to the disease. So you either become immune to the disease because so many people got it, 70, 90% of the people get infected, or there's a vaccine. So you only get herd immunity through one path or the other. Now, herd immunity through natural infection would be disastrous. So if you said that 80% of the United States population needed to be infected, that would be 264 million people catching COVID in the United States. Now we're already up to like 9 million, I think. With 264 million cases would cause about 15 to 16 million hospitalizations and about 8 million deaths. So, the strategy to just let this disease spread and let's just live with it would cause a lot of harm. In addition, it would also overwhelm our healthcare system, which we're already starting to see, and we have not gotten anywhere near these numbers. And I'm going to show some information on that. In addition, this is not going to cause herd immunity because herd immunity, if you do it through natural infection, would mean that you don't get reinfected. So we are now seeing people who actually recovered from COVID and then caught it again. What we're seeing is that the antibodies to COVID begin to go down in your body at about 90 days. So people are catching it. This particular person in Nevada, his second infection was actually worse than the first one. This is a British study that came out that actually shows that immunity to coronavirus wears off. And so what they actually did was they actually checked and they said after 3 months, over 3 months period of time or 90 days, there was a 26% decline in the antibodies, right? And that actually kept on going as time persisted. Now, let's talk about vaccines. This is a tape that I want to share with you guys, and this was Dr. Fauci just recently talking about vaccines, and this is a very interesting conversation, and I'm going to play it. Hold on just a second.
And that's the primary endpoint of most of the virus, is to prevent clinical disease, to prevent symptomatic disease, not necessarily to prevent infection. That's a secondary endpoint. But the primary thing you want to do is that if people get infected, prevent them from getting sick. And if you prevent them from getting sick, you will ultimately prevent them from getting seriously ill. So that's what we want to do. The first point, which we call a primary endpoint, is that if the vaccine also allows you to prevent initial infection, that would be great. But what I would settle for, and all of my colleagues would settle for, is the primary endpoint to prevent clinically recognizable disease. And that's what we hope happens. And if we do, that will go a long way to diffusing this very difficult crisis that we're in.
Of course, and going to the point that you've made that the vaccine won't be the end of the story, definitely mitigation tactics will remain in place for some time. Going on to the trials themselves, it seems like the UK is setting up to do a challenge trial, and while we already have some vaccines in late stage trials here, it does seem that with the number of candidates out there, there's some room for using this strategy. Is the US setting up to do a challenge trial as well?
You know, we really don't think that that's necessary. When you have so many infections, I mean, we're having in this country, as we started the discussion off, with over 80,000 infections per day. Fundamentally, when you do challenge studies, there are a number of reasons, one of the most important of which is that there's not enough disease activity out there for your vaccine trial to give you a definitive answer. And even though challenge studies may have a place under certain circumstances, it's not the same as the actual circumstances with which a person gets naturally infected. So, although you can get some good information from a challenge trial, the real world information that you want is out in the field when someone is actually being exposed to natural infection and to determine if the vaccine prevents against that. So right now, we're not planning any challenge studies because we have so much infection going on. We have 5 or 6 vaccines that will be in trial in the midst of these 80,000 per day infection. I think we're going to get enough information that we need to make a decision as to the safety and the efficacy of a vaccine without resorting to a challenge trial.
All righty. All right. So I thought that was actually really interesting because he actually really talks about that this first set of vaccines, and he's setting the bar low, is really going to actually stop you from having symptoms, not necessarily stop you from having the infection, which means there may still be a need for masking. Um, all right. I just wanted to show a couple of things here regarding the status in a couple of states. Wisconsin State opened up their fairgrounds and built field hospitals because their actual hospitals were overwhelmed. Utah said that their hospitals are at capacity. They actually started in Utah discussing what would be their rationing of healthcare. This is the article where they actually talk about that the overcapacity is unsustainable, and that they actually need to begin to actually have a conversation about rationing healthcare and deciding who will or will not get a ventilator, who will or will not get certain medications, etc. Idaho hospitals are also full, and some of these states also where the hospitals are full do not have mask rules. So as these infections increase, you will see that these hospitals are going to get more and more strained, and there may be some decisions that are made that are going to be really difficult decisions about who's going to get what. So when you talk about our healthcare system, there are a couple things about our healthcare systems that causes us to actually really have a problem with a pandemic like this. One is that air, trains, buses, and major transportation, they are transmission points. And we basically had non-existent health screening at these points. If you go to other countries, like in Asia, you will see infrared temperature testing, that you're just walking through the airport and they're capturing that information. Scalable contract tracing has not been in place in all states. The funding to the CDC, NIH, FDA has been cut over many, many years. So they've been unable to really recruit experts or have compliant labs. We have a lot of health deserts in the America where people are an hour away from a hospital, or their hospitals in their local neighborhood have closed. You have health insurance that's tied to your job rather than your body. So that doesn't work very well when there's a pandemic and you have massive unemployment because the economy has shut down. And then we don't have universal sick leave. So people, if they're sick, they have a financial incentive to go to work, even though they're sick and can possibly spread it to others. Some critical dates. January 12th is when China gave us the genomic sequence. January 15th was when we had our first diagnosed case. January 28th is when the CDC announced this test. February 13th, about 2 weeks later, is when the CDC realized that the test didn't work. And then February 29th is when we had our first death related to COVID. And March 13th is actually when the president declared a state of emergency and we went into our first lockdown. Looking back, it looks like there was an increase in respiratory cases going all the way back to December. So we may have actually had some of the first cases in December. Overall, we think that about 75,000 more Americans died from COVID than actually is reported. What's happening now is you're not reported as a COVID-related death if you don't have a positive swab. So think about somebody maybe who's elderly, they're at a nursing home, they're DNR. We don't necessarily do a COVID test on them if they come in, or even a sudden death, a patient's sudden death, and we're unable to resuscitate him, that person, then we don't do a COVID test, even though we know the symptoms sound like COVID. So if the COVID test is not actually done, then they are not counted. So there is an undercounting of the actual number that have died from this. These are death rates in the United States. The top row is death per 100,000. The top row is United States, and the last column is deaths per 100,000. We're 67.14. Then you can see all these other countries in relationship to ours, right? So we're really not doing well. Russia has a lower death rate, Germany, even Iraq, Netherlands, Pakistan, a lot of countries have a lower death rate than we do. These are all the countries that have a lower death rate than the United States based upon deaths per 100,000 of the population as of October 19th. Then the other important thing that you want to look at is how many COVID tests do you do per one confirmed case. You want to do a lot of testing because you really want to look at this and you want to find clusters of disease. So the countries that have done best are Vietnam, New Zealand, Australia, because they've done a lot of testing to get to one positive test, right? Then you'll find the countries that have not done as well are the ones at the bottom, and we're very close to the bottom, United States, India, Philippines, Indonesia, South Africa, etc. All right, let's talk about voting real quickly. Number one thing you can do now is get a flu shot. If you're over 65 years old, you want to get a high concentration flu shot. A lot of people ask, why do I say that? And I say that because what is going to happen this year is that people are going to catch the flu and COVID. And that is going to really be a lot for them. COVID alone is a lot, but we are finding where we have co-infections in the wintertime. So to mitigate that, you want to actually get a flu shot. The other reason why you want to get a flu shot now is a flu shot takes 2 weeks to become effective. So if you take it now, it will become effective the second week of November or so. So you want to actually get your flu shot now. Number one thing to do is get your N95, KN95, or N99 mask. As I said before, the fabric mask or the sort of medical, dental, surgical mask, those are about 40% effective. These masks are 90% effective. They are about $2 to $2.50 per mask on Amazon. You can get 7, so you have one for each day of the week and rotate them and use them for about a month or so. So they're 5 layers. They're actually a little bit more comfortable to talk in. They have a little bit more space for you to talk and breathe. So they're actually a little bit more comfortable. And so I'd say to people, upgrade your mask so that you can, if you want to go to the polls, you want to upgrade your mask before you go into the polls. You want to make sure your mask does not have a valve. You want a no valve mask, which is a mask to the right. Neck gaiters. I see people with these pieces of fabric or neck gaiters. Neck gaiters themselves increase the actual COVID-19 transmission. You know, a simple bandana is just not enough. I wouldn't even bother to use it. Bring your own chair, water, snacks, hand sanitizers, and wipes to the polls. I know my parents went to the polls. It took them about an hour and 45 minutes. You want to make sure you're comfortable. This is obviously in addition to your mask. I specifically actually recommend hand sanitizers or wipes as opposed to gloves, because people are more likely with gloves to actually touch their face and infect themselves. So it's just better to wash your hands, use the wipes, and wipe down surfaces. Best strategies for voting. If you have a Secretary of State voting drop box, that is the best. If you have a absentee ballot drop off at the Secretary of State, or sometimes some states allow you to actually drop them off at the polls. Early voting is good. You want to actually try to go as early in the morning. Things have not been touched as much. Vote in person. If you're going to vote in person, make sure that you have an N95 or a KN95 mask. Oh, let me just add one other thing. I need to add this to this. If you have anybody who's hospitalized, there's a organization called patientvote.org, and they will help the elderly or people who are hospitalized, or maybe they're on hospice care or they're on in-home care. They will help them in any state get their ballot and vote. It's called patientvote.org. All righty. I'm going to show this again because I just love this cartoon. This is my favorite.
At 1-800-CONTACTS,
we're going to have a little Disney here. All righty.
That's why we have 24/7 customer service, so Bob can chat with.
Wear a mask, wear a mask. Is this really much to ask? Tie some fabric round your face, oh, it's the simplest of tasks. At the gym, at the store, don't treat it like such a chore. No, these mandates aren't malicious. All your theories are fictitious. Stop the lies, stop the fights. No one's taking away your rights. All this speculation makes me need a flask. Come on and read some data. All you masturbators, wear a mask, wear a mask, wear a mask.
It's a mask, it's a mask. Heaven's sakes, it's just a mask. Such a shame that asking folks to follow rules gets you harassed. You can shout, you can glare, but listen, Karen, I don't care. Never seen folks so dramatic over a f***ing piece of fabric. Hard to breathe, feels too hot. Quit your bitching, there's a thought. Suck it up, and don't you give me any sass. We've got a lot to do, and it's not just the flu. So wear a mask. 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 Get your head out of your ass. Try to think of someone other than yourself is all we ask. While you sit watching Fox, ignoring science and the docs. Wow, your ignorance is showing as the death toll keeps on growing.
Case by case, test by test. Don't forget, you're not oppressed till we put this damn pandemic in the past. Try not to be so grouchy, have some faith in Fauci. Wear a mask, wear a mask, wash your hands and wear a mask.
All righty. All righty, we are going to go to question and answer. All righty, give me just a second to turn this broadcast over. I hope you all enjoyed that. Let's see here. Oh my gosh, I got some questions already. Hold on a second. Let me put this up here. Okay. All righty. All right, all right, here goes some questions. Shouldn't the vice president be quarantining and not traveling? Yes. So when you have contacts that you are in contact with, like your chief of staff and people that you work with that are positive, you can do a couple of things. So number one thing would be to quarantine. The other thing that he could do is he could actually quarantine for a shorter period of time, like a week, and have like 2 tests that are like 8 days apart that are negative. You almost always turn positive within 8 days, and you almost always have symptoms within 14 days. So absolutely, he should be quarantining and not traveling. Okay. Okay, I am a caretaker of a 102-year-old lady who is sharp and maintains her activities of daily living. Great, great. She has not received her absentee ballot in the mail. We would like to drive her a few blocks next Tuesday to vote. She will be in a wheelchair, so she may not have to wait in line. Do you think it would be a good idea to take her there to vote? Oh my gosh. Okay, we have an N95 mask and watch your program diligently each Tuesday and Thursday and utilize standard precautions for COVID-19. Okay, so there's a couple things that I would do. I would first actually call the Secretary of State for whatever state that you're in, and tell them that she hasn't gotten her ballot and see if they allow you to actually pick up her ballot. That's what I would do. The second option is that, so when I talked about patientvote.org, what they help, a lot of states have what they call an emergency absentee ballot. So you could also contact patientvote.org and see if they could help her get her ballot. Those would be the things I would do now this week. Because if there's any way you can get her ballot, I'm not as concerned about that she's going outside. I'm more concerned about how many people and things she's going to come in contact with, standing in line to vote and all of that sort of stuff. So I would try to get her ballot first, either through patientvote.org or by calling the Secretary of State. Then if not, if she really, really wants to vote, I would hand sanitizer, wipes, and go on in with the N95 mask and all of that. So not ideal, but I understand. When is an asymptomatic person first contagious? What's up? Very good question. Very good question. So there's two things. Okay. So there's an asymptomatic person. That's somebody who catches a disease and never actually develops symptoms throughout the entire disease. And the disease ends and they were completely asymptomatic. Okay, that's number one. Number two is pre-symptomatic, which means I'm asymptomatic now, but I'm positive and I don't know it, and I'm shedding virus, but I become symptomatic next week. So asymptomatic and pre-symptomatic people both do not have symptoms, and both of them are contagious. So you are contagious as soon as you actually catch the disease and the disease deposits in your nasopharyngeal area. You normally become symptomatic, if you're going to become symptomatic, within 8 to 10 days. So I hope that answered that. Okay, all right. Asymptomatic people or people with mild symptoms, what are the chances that in early December or late November, people contracting the virus, people were contracting the virus and just doing home treatments? Oh, you are. So now, wait a second, I want to make sure I think that you're asking about last year. So that's very likely what people were doing. So last year, people didn't know about COVID in December. They didn't think it was here already. And so we've already seen where there was probably COVID cases that were going around at least in November and December, and we were unaware of it. This is why testing is so important. It's very, very important to get testing out there very, very quickly. I hope that answered that. All right, if you don't mind, please tell me or not what a person with A positive blood type and sickle cell trait is more vulnerable to COVID-19. Okay, all right. So now the sickle cell trait, I'm not really sure about. So when someone has, I haven't seen anything that actually shows what actually happens with sickle cell trait in COVID-19. Now, blood type in COVID, we did go over. I have not seen any difference about whether or not you're Rh positive or Rh negative. But the people who are A and AB, so blood type A and blood type AB, are the ones that are more likely to get the infection and more likely to get a very serious infection. So if you told me somebody was A positive with a sickle cell trait, I'll tell you, yes, they are more vulnerable to get it, and they're more likely, when they do get it, to have a very, very serious infection. I did, okay, so someone wants to know if I had to watch the link with Tammy Clark and Kristen. No, did you send it to me? So somebody wants to know if I watched the link. Did you send it to me by email? So I did not get a link with Tammy Clark and Kristen Megan. If you can put that link in the Q&A or chat, I will take a photo of it. I did not get a chance to watch that. So my assistant who helps me out with these slides actually lives in an area where she was near the storm, a storm that is coming in. So I actually did not. But if you can put it in the link for me, if you can put it in the chat box, or if you can, best to put it in the chat box and I'll take a quick picture of it. If you could do that for me, Terry. All right. And Daryl says, thank you. All right, thank you. So, all righty, hold on just a second. All right, and we have a question. Lillian, you have your hand up. Okay, Lillian, go ahead. Lillian, you have your hand up. You can unmute. Lillian, I put in a request for you to unmute yourself. Let's see here. Hold on just a second. Let me try this again. Okay, Lillian, I have asked you to unmute, so I need you to unmute yourself. Okay, all right, let me send Lillian a message. Okay. Hold on, give me just a second. Any other questions? All righty, let's take a look here. Okay, Terry, are you going to put the information in the chat for me? And does anybody have any other questions? Okay, there we go. We've got, okay, all right. Terry said he has to find it. He's going to put it in the chat for me. Okay, all right, great. I will take a quick photo of it, and then you can send it to me, and I will incorporate it and give you my thoughts at the next presentation. If there's any information you want me to review or take a look, I would actually, I'll take a look at anything. Oh, okay, so got another question here. What is the reason blood type A is more vulnerable to the disease and more likely to get sick? Please repeat it. I didn't actually give you a reason because we don't know a reason. So we don't know why. We just have noticed that when you look at the folks that are in the ICU, so it's a correlation that we've actually noted, but we actually don't know why. They believe that it might possibly have to do with the proteins that are on the surface of the blood. But we actually, we have not actually figured out why yet. So we're still working on that. So we just know that we see it in a higher percentage in those particular patients. So it's more of a characteristic and a correlation right now, without an actual reason why. Good question though. All righty. Let's see here. If you have a question, you can just raise your hand or put it in the chat box. Terry is looking forward to put in the chat box. Anybody else have any question or anything that they want to ask? I'm giving people a little time to type. I think that, one of the things that was really important for this presentation to me was the actual interview with Dr. Fauci. I think that, knowing that these first vaccines may just prevent the symptoms and not actually prevent the symptoms, but not actually prevent the infection, is important. Okay, all righty. So Terry, you gave me here the information. I'll take a look at it, and then I will. Is there something about this in particular, Terry, that you had a question about, or you just want me to review it and comment on it? You can just put that in the chat and let me know, or you can raise your hand and I'll try to take you off of mute. No, I just want you to listen to it. Okay, all right, I will do that. I will listen to it and give you my comments. All righty. Okay, any other questions? All right, so Terry's saying that what he has, that he wants me to listen to is a trip. So, okay, all righty, we will see. All righty. I'll give people another half a second here, see if there's any more questions. Okay, I want to thank you guys. That always happens. Given my professional medical background, have you ever lived through a COVID-19 situation before? Absolutely, absolutely. You know what? Yes. So when HIV first came out, we didn't know what it was, and it was called immunodeficiency disease of unknown origin. Then it was called immunodeficiency disease of unknown origin in men. And we didn't know if we didn't know if it was a respiratory disease. We didn't know if it was we didn't know at the time it was a bloodborne disease or sexually transmitted disease. Like, we really didn't know. And then over time, we realized that it was a sexually transmitted disease. And I don't know if you remember, but there were some people who still thought that they could catch it by just being around someone who was HIV positive. Like, everybody wasn't really sure. It was a really big deal that one of the soap operas had an HIV positive character in it. And a lot of folks initially died. A lot of people died. And then a lot of the therapeutics and a lot of the drug treatments got a lot better. And I don't know if you all remember, but Arthur Ashe died, one of the first Black tennis players. And then later on, you had folks like Magic Johnson, who's now still living, right? So it's the whole concept in a pandemic that you really want to either not catch the disease or live until the therapeutics begin to come out, because the folks who actually catch it early on die, right? Because we don't know how to treat it. We may not have medications for it, that sort of thing. The other time that I actually experienced a COVID-19 situation is that I had two experiences in my career where I dealt with patients that had tuberculosis. One of them was in Michigan, and the other one was when I was in Africa. one of the persons had, and tuberculosis is airborne. So it is very, very easy to catch just with coughing and breathing. And so I had a patient from India who wasn't breathing well. I didn't know that he had tuberculosis, and I intubated him and put him on a ventilator, which requires you to open up their mouth and kind of get in their mouth and actually put the tube in and all of that. And I had to be TB tested and checked and get chest x-rays for 10 years after that, because he had metastatic tuberculosis. He had tuberculosis in his bone marrow. So he's quite a serious case. So yeah, I've actually had a lot of experiences with pandemics. They can come up quickly. It's really, really important that testing, you know who has it, you know who doesn't have it. You're really clear on how it's transmitted. Health information and getting accurate health information out there fast is critical. And it is one of those things where, you know, you try not to let the horse out of the barn, because the horses are very, very hard to put back in a barn after a pandemic when it's not handled correctly at the beginning. So anyhow, I hope that answers your question. I hope this is my last pandemic before I retire. I've got about 10 more years. I'm like, okay. All right, here's a question. Once an effective vaccine is found and begins to be administered, how long do you think it will take? Oh, very good question. For the infection rate to come back down to normal. So the herd immunity numbers work whether or not it's a natural infection or whether or not it's a vaccine. So you need to have about 70% of the population vaccinated before you will actually see regular life go back to normal, 70 to 80%. And that's why I said that's probably going to take us about a year. We will probably see life go back to normal right around the end of 2021 or the beginning of 2022, right? It won't go back to normal immediately because you're gonna have to get all of those vaccines out. And again, in our system where, you know, we have about 40 to 50 million people that are uninsured, right? And so, and then we have some people who may not, for whatever reason, want to get vaccinated. It's going to be really important to roll out the vaccine and roll it out fast and get as many people vaccinated as possible. All righty. All righty. Any other questions? All right. I want to thank you guys for coming this evening. Oh, we got a question. Sure. Hold on. Let me actually. All right. You can unmute, Michelle.
Yes. Hi.
Hi. How are you?
Fine. Question, and you may have covered this on a prior one of your evening chats, but I wasn't there.
That's fine.
By definition, we don't have long-term results from any of the vaccines that are being developed because they're going to be new. So my level of comfort is low, even if they say tomorrow we're ready with a vaccine.
Yeah.
Because we don't know if people can, how many people can get it twice, what that looks, I mean, all of that.
Right. So what they're requiring them to do, what they're requiring them to do is they're requiring them to actually look at what are the side effects within 90 days of getting the vaccine. So your question is, what are the side effects a year later?
Or 2 or 3.
Or 2 or 3. Okay. Or 2 or 3. Right. Okay. All right. So yeah, no, they're not going to have those results. No, they're not.
And in addition to the side effects, I get that. But it's just, we don't, just like for the regular flu vaccine, we have to get one every year because it mutates.
Yes.
This may or may not happen with this virus. I've read that RNA viruses don't mutate as quickly, but what do I know? We just don't know.
Yeah, so we also don't know, if you get this vaccination, will you need to be vaccinated again?
Right.
Right? We don't we don't know that. It does seem like it. So I started looking up, someone had some questions about mutating, and I started looking up some information around mutating. It doesn't look like it mutates fast.
Thing.
So
Yeah.
far,
Yeah.
it doesn't look like it mutates fast. But it seems to me like it's a very, very difficult virus to get long-term antibodies to. You have to get, so when people get the infection, they're not getting T cell antibodies. They're getting like, the temporary ones that go down over time. So that's another thing that they're going to need to really look at is how long does this vaccine, do we have to get this vaccine every 2 years or 3 years or every year? I mean, I don't know exactly. So yeah, that's an unknown. So that's why when you talk about going back to, back to business as usual, it's not, I'm not going to be rolling back. Oh, I got my vaccine. Let me go back to business as usual. I'm still going to be a little bit cautious.
I'm going to wear a mask for the rest of my life.
You,
So-
I hear you. Well, some people in Asia have been doing that since the bird flu.
Exactly.
All right. So you're
Yeah.
going to join them. You're going to join them. I hear you. All right. Thanks. All right. We got another written question here. Oh, thanks. He just said thank you. All right. You're welcome. All righty. Good. All right. So we are coming right at 8:54. I want to thank you guys for coming to this presentation today. Feel free to reach out, have whoever you want. This is the sort of thing where you can kind of come in when it works for your schedule and pick up the conversation. A lot of these things we have on the webinar, and feel free to ask the question again. It's not a problem. There's a lot that goes on with this particular illness, and there's going to be a lot as these vaccines begin to roll out. The ones that are coming from Moderna and AstraZeneca are two-part vaccines, which presents a lot of other issues. And the one from Johnson & Johnson is a single vaccine. So we'll see sort of what happens with all of this. And our goal here is to stay here and stay informed at this location so that we all know we're getting accurate information. All right. Thank you for joining me this evening, and look forward to talking to you on Thursday. All right. Bye-bye.